Thank you very much, Pat. Both Pat and I started when we were 10 years old, just to be clear about that. But I'd also like to thank the Executives Club for the invitation to be with you here today. I'd like to address a critically important topic to our country and really to everyone in this room, and that's the future of healthcare. We're hearing a lot of rhetoric about it on the campaign trail, certainly in the media, and I'm sure that we're going to hear even more leading up to Election Day and into next year when a new administration and Congress take office. My hope is that we'll begin to focus less on the rhetoric and more on the reality, because the future of healthcare, it's far too important as an economic issue, along with the impact that it is having on our workforce. At CVS Health, we believe that health is everything. And think about it. Every one of us in this room, our family members, our friends, we're all patients at multiple times in our lives. And we all want care that is more affordable, more accessible, and more effective. And I believe that we're making progress towards that goal, but at the same time, at this moment, it's as if we have two healthcare systems that are operating side by side. We have the healthcare system of yesterday, in which insufficient competition, it leads those who produce goods and services to produce more and charge more with limited accountability for outcomes. And then we have the healthcare system of tomorrow, in which consumers are more empowered with more choices and more information that ultimately can improve quality and outcomes while driving down costs. So today I'd like to offer you my perspectives on both the challenges and the opportunities that exist in what we call this healthcare delivery system. And my perspective is informed by CVS Health's role in healthcare delivery, both as a healthcare provider and as an employer that, like many of you here in the room, we all wrestle with how to provide high quality, affordable health benefits, in our case, to our more than 240,000 colleagues. And as business leaders and employers, we have a critical stake in this discussion and the realities that surround the future of healthcare. So let me begin by laying out three basic facts. Fact number one, healthcare spending is growing too rapidly, and it's affecting the entire economy. Now, you're probably rolling your eyes and saying, Larry, tell me something that I don't already know. Okay, I don't believe there's any disagreement about this, but let me point out a few simple statistics. If we go back to 1960, healthcare spending was 5% of our gross domestic product. Today it's 18%. And if this trend continues, healthcare will reach 20% of GDP within the next 10 years, and there are a lot of people out there that believe it will happen sooner than that 10-year period. Said another way, 1 out of every $5 in this country goes towards healthcare. Those 2 extra percentage points equate to more than $250 billion a year, money that will not be spent on other national priorities, whether it's education or infrastructure. So clearly, this trajectory demonstrates that there are things that just aren't working in the delivery system. And one obvious example is the cost and cost inflation of brand name prescription drugs. Today they make up 15% of all prescriptions that are dispensed all across the country. And at the same time, these same branded drugs make up 75% of the pharmaceutical spend. And their costs are rising faster than healthcare inflation overall. There are broader issues as well. The prices of many products and services in healthcare do not necessarily reflect better outcomes for patients. And the healthcare system does not prioritize cost as a variable in delivering quality care in the appropriate clinical setting. So I'll expand on each of these issues in a moment, as all of them are contributing to make healthcare more expensive than it needs to be. The good news here is that this current trajectory of healthcare spending, it is not inevitable, but it's going to require paradigm shifts and it's going to require action. So that leads me to fact number two. We do talk about healthcare spending like it's a fixed cost. That's one of the paradigms that we have to break, because it's not. We think about three variables, major variables that contribute to healthcare spending. We think about quality, think about access, we think about cost. And let me briefly highlight these three and the challenges associated with each of them. And I'll start with quality. You think about the management of chronic disease. Today it accounts for almost 86% of healthcare spending. And by the way, today about half of all Americans suffer from one or more chronic diseases. Diseases like diabetes, hypertension, cardiovascular disease, asthma. And more effective care coordination for these patients, including the management of their prescription drugs, could reduce spending by about $300 billion a year. There are a lot of studies out there that support that premise. Contributing to the growth of chronic disease, we hear a lot about obesity, tobacco use. Those two aspects alone contribute about $500 billion each year in unnecessary healthcare costs and lost economic activity. And yes, that's trillion with a T. At the same time, fewer than 3% of Americans follow recommended guidelines for a healthy lifestyle, including diet and exercise. So again, another huge opportunity. If we look at access, today 1 out of every 5 Americans lack regular access to primary care. And as a result, when they need care, they choose the least cost-effective site of care, oftentimes that being the hospital emergency room. I recently read an article about a father whose young daughter had cut her finger. So he rushed her to the ER. He was worried that she might need stitches. Turned out all she needed was a Band-Aid. Now, he was relieved until he got the bill from the hospital visit, $629 for a Band-Aid. And that's not an isolated case. On average, the cost of an ER visit is about $600 more expensive than the cost of alternative sites of care. And by the way, there are many, many other examples beyond the appropriate utilization of the emergency room around how lower cost, high quality sites of care can make a meaningful cost difference. So increasing access to these care settings, another big area of opportunity. That third variable, cost. In too many cases, the cost of products and services in healthcare bear little relation to patient outcomes. Another example, how much an MRI costs depends entirely on where you have it performed. According to Medicare data, the average cost is about $2,600, but in reality, it could cost you as little as $470 or as much as $13,000 for exactly the same scan. And a more timely example that we've heard an awful lot about over the last few weeks is EpiPen. Manufacturer Mylan has raised the price nearly 600% over the last 7 years without any increase in its clinical benefits. And I could go on. However, all of these examples of what's not working in healthcare actually reflect that healthcare system of yesterday. Unfortunately, there are just as many examples of a very different healthcare system that addresses many of those pain points that I just referenced. So that brings me to fact number 3, that there are solutions to these challenges associated with quality, access, and cost. And virtually everywhere you look in healthcare today, you see innovative approaches emerging that are resulting in more market competition. So if we go back to those three variables and look at quality, as I mentioned a moment ago, chronic disease accounts for about 86 cents of every dollar spent on healthcare. And all of us in this room have a stake as consumers, employers, insurers, providers, and yes, the government. Healthy competition is emerging to see which approaches to improving quality will prove most effective. And these include experimental pilots with medical centers of excellence or bundled payments and accountable care organizations, to name just a few. And CVS Health is one of many employers, and I'm sure we have some in the room that are experimenting with the ACO model in selected markets. We're also among the 73% of all employers who are making employee well-being a much higher priority. And as Pat mentioned, helping Americans Quit tobacco is a special concern at CVS Health because smoking-related illness is the leading preventable cause of disease and death here in this country. And that's why we decided, it's been 2 years now, to stop selling tobacco products across all of our CVS pharmacies coast to coast. And by the way, I am happy and honored, and I know all of us at CVS are very proud of the fact that the evidence is showing that that action has made a difference in helping to reduce the rate of tobacco use in markets all across the country. And our focus now, thank you. And our focus now is helping to prevent young people from smoking in the first place. Today, 3,800 kids will smoke their first cigarette. 20% of them will become daily smokers. And we have a goal, working with many organizations across the country, of creating the first tobacco-free generation. Second, if we look at solutions related to access, one of the most important changes I see taking place is I'll call it the proliferation of convenient, lower-cost sites of care that can empower consumers with more choices. And we've been talking about this the last few years as this retailization or this consumerism surrounding healthcare. You look at urgent care centers, retail health clinics, they're growing rapidly. They're up to 80% less expensive than the emergency room for the services that they provide, with the same or better outcomes. And this makes them an ideal complement to primary care and an alternative to the ER for the appropriate services. There's also the greater use of other cost-effective settings like in-home care and telemedicine. So, think back to that ER visit that I mentioned that resulted in the $600 Band-Aid. Imagine if that father had used an app on his mobile device to teleconference with a healthcare professional instead of driving to the ER. That's an example of where healthcare is headed. And thanks to technology, care in retail settings can be coordinated with primary care physicians and other healthcare professionals through the patient's electronic health record. In fact, our CVS Health in-store retail clinics, they're branded as MinuteClinic, have formed alliances now with more than 70 major health systems across the country to do just that, including here at the University of Chicago Medical Center and the Rush University Medical Center. Now, because medications are involved in the vast majority of healthcare treatments, especially those managing chronic disease, you think about, who do you interact with more, your pharmacist or your physician? And I think it's a no-brainer answer, that most Americans have more accessibility and more interaction with their respective pharmacists than they do any of the other healthcare professionals along I'll call it the supply chain. And pharmacists all across the country are playing an important, critical role in making the healthcare system more accessible and also more effective with the delivery of patient care programs. Now, we spend a lot of time thinking about this term medication non-adherence. And it's one that we like to describe, unfortunately, as a nationwide epidemic, because the research indicates that 1 out of every 3 patients who start a maintenance prescription for a chronic disease will decide to discontinue treatment before their first refill is even due. Less than half of those patients are taking their doses as prescribed by their physician, and 3 out of 4 people will stop taking their medication within the first year of being diagnosed and starting therapy as a result of some chronic disease. Now, you think about the fact that, okay, if medication adherence declines, what's the outcome of that? Well, emergency room visits, hospital stays increase among those patients that suffer from chronic illness. So pharmacists are playing an increasingly important role in tackling the complicated issues associated with managing chronic disease and medication adherence. Now, I covered quality. I hit access. What about costs? Well, there are solutions to reducing costs by helping people be better healthcare consumers. And I'll share a quick story with you about a conversation I had with one of my CVS colleagues who was enrolled in one of our consumer-directed health plans. She had a knee injury. She was alarmed about, the cost of an MRI, which I mentioned earlier can be highly variable. The doctor suggested a site that she was, going to go to have, the MRI. It was going to cost $1,300. And the conversation went something like this, that, Larry, under the traditional plan, I had a copay. It was a fixed amount. I paid probably a couple $100. And of course, that might have been her actual cost, but we know that while that would be her copay, the total cost would have been $1,300. And we talked about the fact that, well, did you use any of the cost comparison tools that are available? She hadn't, so we looked it up. We found that there were far less expensive options. She was worried about the fact that the physician had said to go here. Let's call the doc back. Okay, doc said, yeah, sure, that's fine. If that's more convenient for you. So she selected one of the alternatives and reported back that the quality and experience were both great. In this type of consumer behavior, as we think about healthcare, it is very new for many. Think about how many folks, want to challenge the doctor. It's not challenging the doctor. This is where he referred her to go, and she's going to follow the directions well. But it's becoming more common, and it's going to cause more and more providers to compete on both quality and cost. So let me come back to prescription drugs, because there are market solutions to make pharmaceutical companies compete to lower prices. And if we take a look at one pretty high-profile example, in 2014, the drug Sovaldi was introduced into the marketplace as a revolutionary cure for hepatitis C. At the same time, there was a lot said, written, a lot of outrage over the cost, $84,000 for a 12-week treatment cycle. As a result of a competing drug being introduced in the market several months later with comparable therapeutic effectiveness, along with tough private sector negotiations by pharmacy benefit managers, the price was actually lopped in half. And as a result, the cost of treating hepatitis C patients here in the US last year was lower than many government-controlled healthcare systems pay. Now, it is a fact that pharmaceutical companies are raising prices for new and existing branded drug at rates exceeding healthcare inflation overall. And pharmacy benefit managers, also referred to as PBMs, are responding to those tactics with aggressive cost reduction strategies, in part by combining the purchasing power of millions of Americans on behalf of their employer and health plan clients. And I think this slide tells that story in a very powerful way. This red line, it actually shows the average year-over-year inflation percentage point change for, I'll call it the list price of branded pharmaceuticals. This gray line, or black line, close enough, okay, on the bottom, it actually shows the net year-over-year inflation change for those same drugs, resulting from negotiations with PBMs. And by the way, those strategies are most effective when there is product competition within a class of drugs, particularly from generic pharmaceuticals or biosimilar products. And today we hear a lot of rhetoric from pharmaceutical manufacturers about innovation, but when they don't face competition, they've demonstrated very little innovation in pricing their products in ways that consumers can afford. It's also important to note that PBMs deploy a variety of tools and capabilities to ensure that clients and their members receive the right pharmaceutical care at the lowest possible cost. And this past year, 2015, what we refer to as the drug trend. So as an employer, how much did your pharmacy costs increase from one year to another that would include not just inflation rates, but increases in utilization and so on and so on. That drug trend for clients of CVS Caremark was less than 5%. In year-to-date this year, 2016, it's running at about 3.5%. In both cases, well below the published inflation rates that were shown by that red line. So, let me wrap up here my prepared remarks kind of returning to where I began, that healthcare spending is increasing too rapidly, and reducing it has to be a national priority. And that doesn't mean that it should only be a priority inside the Beltway in DC or in our state capitals. As I mentioned at the onset, while healthcare is about people, fundamentally, we face an economic challenge. And through competition, whether we're employers, providers, insurers, others, we're discovering market solutions to the challenges surrounding access, quality, and cost. And let me leave you with one final fact, that common sense, market-oriented reforms, they have helped address quality, access, and cost, but there's more that has to be done. First, there's the opportunity to continue to improve the Affordable Care Act. And I don't want to get into a political debate about the ACA, because whether you originally supported the ACA or not, I think everyone in this room would agree that it has increased access to care for about 20 million people that did not have the same access to health insurance that everyone in this room has 3 or 4 years ago. At the same time, much more has to be done to make sure that that access is affordable. Second, federal government can improve quality by funding objective, comparative effectiveness research. This would help Americans distinguish between procedures, services, and drugs that actually provide greater value from those that are simply overpriced. And the government can do more to add to the drugs that are on what's known as the preventive drug list, to help prevent, treat, and manage chronic illness. And third, let's create more competition to lower the cost of prescription drugs by increasing the flow of generic pharmaceuticals and biosimilars into the marketplace. This is critically important. Today, would it surprise you to know that there's a current backlog of more than 3,000 potential drug approvals in the Food and Drug Administration, many of which are generics. Clearing out this backlog and increasing the speed to market of new biosimilars, it needs to be a top priority. Now, all of that said, I do remain optimistic. Call me crazy, okay? But I believe that we can get past the rhetoric, focus on the facts, bring all the stakeholders together around a common sense agenda to create a system that's more affordable, more accessible, and more effective. And every one of us in this room has a huge stake in that debate. So I hope you will be actively engaged. Let's complete the transformation of American healthcare, and let's create a system that works for everyone and one that's sustainable for years to come. So again, thanks for the opportunity to be with you here today, and I look forward to your questions. Pat, you were taking a lot of notes, so.
Well, the questions are rolling in here. I'm supposed to remind you that the instructions are at your table and you can text in questions, but I'm not sure I need to remind you because they're rolling in. Great comments, Larry. Obviously, an area that is so critical to all of us, as you indicated, not just our businesses, but us personally. And I, for one, appreciate your optimism because it is complex and sometimes it's easy to not be so optimistic, so thank you for that. Also, before I take all these great questions from the audience, I'm going to go forward with my own question for you, kick it off. And first of all, before I start that, congratulate you and thank you for your leadership. You got applause here earlier, but I think you deserve it again. Courage and leadership around the tobacco issue. I mean, really amazing. So, I remember that morning 2 years ago, and I was watching MSNBC, and I was putting my makeup on, getting ready, and the news came on that, in fact, you'd taken this bold move. And I couldn't help it. I yelled out, "Way to go, Larry!" And my husband was in the other room. He said, "Are you in there with somebody?" No. A little explaining to do there. Anyway, so bold move. And not everyone was as enthusiastic as I was when I heard the news. I know that it was controversial, particularly from the investment community. So can you share with us what went into the process and how did you and your team get to that point to make that decision?
Yeah, Pat, it's a great question. And, there was, I think first, as we thought about our business and where we were headed as an organization, we were becoming more of a healthcare company. And I think, we wrestled for years in terms of, the infamous who do you want to be when you grow up? Not that any of us ever grow up, okay? And, I sat with, some of you here in this room today that would be having great discussion, about, the different businesses that we operate and how, we can work together, partner together to be an important part of the solution. And, oftentimes it was the chief medical officer in the room that, would be probably 3/4 of the way through the conversation, and he or she would say, let me ask you a question, don't you guys still sell tobacco products? And literally, you kind of wanted to, crawl under the table, and, it sucked all the energy out of the room. And, as a leadership team, we talked about the fact that, this issue is going to be a barrier to future growth. At the same time, tobacco represented about $2 billion in revenues. And, Pat, you brought up investors, and, in this marketplace, folks are always focused on, not what you're going to do 2 years from now or 3 years from now, but what you're going to do next quarter. And, we had a lot of discussion about it. There was never going to be, a perfect time to walk away from that, but we said, you know what, now is the right time. With all the changes going on in healthcare, the role that we see ourselves playing as part of that solution, it's the right thing to do. And, we took it to our board. We got tremendous support from our board of directors, and I'll never forget, as we talked about it in that board meeting, one of the directors said, Larry, I think you got a lot of support for the decision. Don't be shy about telling the story. And I thought that was very good counsel, and, it led to, a part 2 strategy of rebranding the company from CVS Caremark to CVS Health, recognizing and reflecting our broader, commitment to healthcare. I think probably one last point around that, we were concerned about, because I'm sure we have many CVS Pharmacy Extra Care card holders here in the room. Thank you. And, and yes, we sell, I mentioned obesity earlier, and we sell candy bars and chips and soda, and, and we collaborated with a lot of healthcare professionals about the inconsistency that potentially represented. And almost to a person, what we heard back was, listen, those products taken in moderation or occasional use have not been proven to cause the medical harm of tobacco. There is no amount of tobacco use that can be considered safe. And we will support that decision, all day long. And, Pat, thanks to folks like you and, many of your colleagues across the country, they've stood true to, to that commitment. And, and I think once we made the decision, then we could go out and talk with consumers. And, the piece of advice that we got from consumers was, help me understand more healthy choices. And, and we've gotten support from some of our supplier partners, like, the folks from Pepsi are here today. And, we share a common goal in terms of how we can make, snacks more nutritional, whether it's reducing sodium content or sugar content, and to help educate consumers, about those alternatives. And, our retail team has been, on that journey for the last, 18 months. So, so that, Pat, that's kind of what's been behind the story. And as I mentioned in my remarks, we are proud of the fact that when you look at the rate of tobacco purchases across the country, there is a direct correlation between CVS Pharmacy market share and reductions in the rate of tobacco purchases. So we're quite proud of the fact that that has made a difference.
Well, you answered one of the questions, because one of the questions that came in was, okay, what about the grocery side? And you've done a great job answering that. And it makes sense. There was also a comment about, what about the alcohol side? I think you do sell alcohol, right?
We do.
It's the same thing, the whole moderation thing?
Yes.
Good. I want you to keep selling wine and keep selling Snickers, so don't stop that. Moderation, I can handle that.
Okay.
So you talked, one of your points was about medication adherence, which is really shocking when you look at the numbers related to that. Now, all of us, I can see people sneaking, taking a look at their phones, and of course, I know you're all texting things up here, you're not really checking your email, But there's an opportunity there, I think, with technology to improve adherence. Are you doing anything, is CVS doing anything in that regard?
Yeah, Pat, there's a lot that we're doing, and I know that others are doing. I know my colleagues are here from Walgreens today, and I think they share a common view of the role that pharmacists play across the country in terms of being part of that solution. But I think this whole issue starts with really understanding why patients are not adherent with their medications. And again, many studies have been done. And if you turned around and said, Larry, give me the top 3 or 4, okay? Cost is a variable, whether it's co-pays rise, okay? Some of the things that I alluded to earlier in terms of, the cost of, pharmaceuticals, that drives, medication non-adherence. It's interesting, some of the conditions that associated with chronic disease, they're asymptomatic. You think of an individual with high cholesterol and that may be on a statin, they don't feel any different after as they did before, and oftentimes they get a side effect of muscle weakness, and that can be a reason for not taking their medication. So our pharmacists work with patients to understand when their refills are due, and engage them in conversation to attempt to understand for that particular individual, what is their reason and how we can help them, whether it's, to work with their physician to get them on a lower cost therapy, or perhaps, have a better understanding of, the side effects that, are problematic for them, okay? And, and you mentioned technology, that, I think that is still emerging, that, we have made a lot of investments in digital capabilities over mobile devices. So if you've downloaded your CVS app, you can go into the pharmacy component of that. You can enter, maybe you're on a statin that you have to take twice a day, and you want to take it at 7 a.m. and 7 p.m. and your phone will ping you, okay, when it's time to do that as a reminder. And we're experimenting with all kind of things like talking caps on a prescription bottle. I'm looking over at one of my colleagues, Anita, who is working on that and smiling, and I do think that will only get better as we go forward. But I don't want you to lose sight of the fact that understanding all the different reasons, really understanding that and building a solution to each one of those is what's critical. Because if you've talked to one patient as to a reason why, you've heard from one patient. They're all not the same.
Getting consumers, patients engaged is always a big challenge. And you talked about site of service in your minute clinics, which have been great. Your example of the emergency room, I think all of us could relate to either personally from our business perspective, and it is a big issue. Can you talk a little bit more about other opportunities beyond the retail clinics, the minute clinics that you've developed? And also, how do we motivate people to think differently when they're in that situation and they've got a circumstance they need to deal with? How can we motivate them to be more thoughtful about what they need to do?
Yeah, I think I'll start, Pat, with I think part of it's education, and I alluded to some of the examples. I think we all see insurance plans designs evolving. What I alluded to earlier is this, whether you want to refer to it as consumerism or you think about all of us as retail consumers. Each of us has our own value proposition about where we choose to shop, and there's a reason why. And that decision rests with us. We're beginning to bring the same thing to healthcare and demystify some of the things that I think have existed for many, many years. And where there's not, you think about as individuals, the migration from having a fixed copay expense for, whatever, treatment is being rendered, but yet, your health plan, your insurer is bearing the rest of that cost, and you have no idea what that is. The migration of, plan designs to what is referred to as consumer-directed health plans or high deductible health plans, that is moving that accountability, to us as individuals, as consumers of healthcare, but we've got to provide the education, and the information with which to make those, informed tools or informed decisions. We need to give them the tools. And, that was a little bit of the example that, I used earlier about the MRI. But, there are many other examples. We have an infusion business. And, think about infusion, think about someone who's on some type of IV. Maybe it's, an antibiotic therapy for a serious infection that, they need to receive that treatment for another 45 days, okay? And, that care can be performed in an outpatient center, affiliated with the hospital. We operate what I'll call retail ambulatory infusion sites, or we can perform that care in the office or in the home. And if you look at the cost associated with each of those treatment sites, the most cost-effective site to administer that care is in the home. But yet, most people don't realize they even have an in-home benefit, or we can do that in the office. So, it's another example. It parallels, Pat, exactly what you alluded to, with MinuteClinic. It's interesting with, with over 200,000 colleagues at CVS Health, we like to use our own employee population as kind of our learning lab. And, this is real data. We looked at our CVS colleagues that utilized MinuteClinic. We adjusted it for age and health status. And what we found was their overall healthcare costs were 8% lower than the control group. And there were many reasons why. One of the biggest ones being, getting the appropriate visits out of the emergency room and into the clinic. And and what's interesting about our clinic, 50% of the patients that we see in our clinics today do not have a primary care physician. Back to this issue of people lacking access to primary care. By the way, I worry about the fact that that's going to get worse. You think about the growing shortage of primary care physicians, that number is going to double, within the next 5 to 7 years. So again, the role of nurse practitioners, pharmacists is going to elevate in its importance. The other interesting data point is 50% of the patients that we see are nights and weekends. So their primary care doc, for those that do have access, may not be available. If we don't exist, where do they end up? ER.
Right. So site of service is a big driver and big opportunity in terms of what we could do with healthcare costs. But certainly, pharma costs have been in the spotlight, maybe in the crosshairs is a better way to say it. Recently, we've had some very visible examples. You mentioned Sovaldi, but most recently we've had Valiant and the Mylan with the EpiPen situation, which not only are we all focused on it, but our friends in Washington, D.C. are focused on it as well. What are your perspectives, or what do you speculate? Of course, who knows what's going to happen in Washington, right? But clearly it will be a topic to be addressed. Because the stakes are high. And what are your thoughts about what we might see coming out of Washington related to pharma costs?
Yeah, it's a great question, Pat. And listen, I don't think we want to. I want to stay away from the political, debate. I'll just, acknowledge that, the only thing we've seen from Mr. Trump is, repeal the ACA. We have seen, some proposals from Secretary Clinton that speaks directly to that question. I think we're all encouraged that she believes that introducing competition, eliminating that backlog in the FDA, speeding the approval process to get drugs to market to include generic pharmaceuticals and biologics or biosimilars is important. So we share her views on that. I would say that we'll continue to hear a lot about price controls. We probably differ, in our view of that. I do believe that, private sector innovation is critical as we think about solutions. And, the example that I like to point to, I think probably most here in this room are familiar with, the Medicare prescription program, Medicare Part D for, seniors, gaining access to prescription drugs. You're going to see a lot of commercials, over the next probably 6 weeks, because the annual open enrollment period opens this Saturday and continues, I believe, through the first week of December. What's interesting about that program, it's now about a decade old. When the Congressional Budget Office scored that program, more than 10 years ago, and if you look at what it's costing today, it's about half the cost. And I think many, believe and attribute, the reasoning behind that is, yes, the government has controlled, let's call it the guardrails, with which if you have a product in that space, here are the rules that you need to conform to, okay, to satisfy the requirements that they've established. And by the way, I think we all wish that they were a little simpler, okay? But be that as it may, once they defined those rules, they handed it off to the private sector and said, here, go at it. And I think what we've seen is private sector competition and innovation has been a key component of driving down the cost. So, I maybe this is perhaps, wishing for success, but I honestly believe that, the new administration, whoever it may be, will be very sensitive to not destroying the private sector innovation that exists in this country, not just in healthcare, but probably every industry that everybody in this room is part of and competes with. So I think that becomes an important part of that solution.
Well, speaking of private sector innovation, one of the questions here, which I think great, Apple and Amazon have sort of flirted with the healthcare industry because they see lots of opportunity. But there's also the potential for there to be a huge disruptor in terms of what the current supply chain looks like. Any thoughts on that?
Yeah, it's that's something we spend a lot of time talking about. As you think about, I'll talk about CVS Pharmacy for a minute, because I think, we're trying to figure out, what role does, digital play, for our customers. And it's interesting. Pat mentioned we have 9,600 pharmacies, and we can have a trivia question. There's one state where we don't have any pharmacies. No, I won't go there, okay? But we have a lot of our colleagues that are volunteering to go there this winter, okay, while they're skiing to find a site. So that gives you a hint, okay? But today about 75% of the U.S. population lives within 3 or 4 miles of a CVS. So we have this aspect of convenience, and you've heard this term omni-channel, and I think we're spending time working to understand what does that mean for our business and for our customers. So you've seen us in the last few months develop this program called CVS Curbside, where a customer can take their mobile device, they can order products online through GPS technology. We know when they're pulling up to the curb at the store, and we can go out, put it in their put the bag in their back seat, and the payment is made electronically. We think that maybe that is part of the answer for our customers because of our convenience, our accessibility, and it gives customers the opportunity to use us the way they want to use us when they want to use us. If they want to come in and shop in the store because they have more time, they can do that. If they're in a hurry and want to pick up 3 or 4 items on the way home from work, they can do that. So we're experimenting to understand. I think it's critically important, and you think about our digital properties becoming part information, part healthcare access, and part commerce, for the reasons that I mentioned.
Wow. I had no idea that I could pull up in my car and have someone come out and put Snickers and Sauvignon Blanc in the back seat.
Pat, I hope you'll spend a little more than that one.
So we need to wrap up here. One last question. You've done such incredible things in your role as CEO. Only the 4th CEO at CVS, 7 years. You've made a huge difference for the company. going to different lines of business, diversification, growing the company, amazing things. As you look forward 20 years from now, what does CVS look like?
That's great. Great question. When you talk about CVS, everybody thinks, oftentimes they think first about CVS Pharmacy. And, so maybe I'll start there because, we wrestled for years, are we a convenience store that has a pharmacy, or are we a pharmacy that has a convenience offering? And I think as we go forward, you'll see, the retail pharmacy evolve. It's not a revolution, it's an evolution from, something that exists today that's a whole bunch of products and a whole bunch of different categories. And I think there'll be, a key focus on, the health aspect of our store and the beauty and the personal care categories within our store. But I think you'll see, an emergence of a combination of both products and services, whether it's, our, in-store clinics, our minute clinics, or, we're actually piloting audiology centers, to understand, exactly what, that may mean. And we're doing the same thing with, with optical centers. So, I think that, that evolution, will, it's not going to happen overnight, but, it'll occur, over years. And, and I do think that, the role of the pharmacist, will continue to evolve. You look at the practice of pharmacy, and it's largely governed by regulations that exist within every state. And I would say it's something that we talk about, not just at CVS, but we talk about it as an industry. Because, technology has helped to improve, and enhance the role that pharmacists can play, but the regulations are lagging their capabilities. And we like to talk about the fact that pharmacists need to work more with their minds than they do with their hands. And that's probably a nice way of saying there are a lot of administrative duties that, 20 years ago, the pharmacist did. Technology has been a wonderful thing to be able to have those duties performed by a pharmacy technician without compromising, the quality and safety that we all aspire to with every customer and patient interaction. Okay. So I think that will be an important, component, okay, in terms of the enhanced role of the pharmacist, recognizing, some of the dimensions that, are coming, whether it's the shortage of primary care docs. And, I guess, Pat, maybe I'll just wrap up the question with one good example, because we all remember the H1N1 scare back in 2009, okay? There was tremendous anticipatory panic all across the country in terms of how are we going to make sure Americans get access to that flu vaccine. And at the time, there were probably a half a dozen states that actually permitted by regulation, by law, for pharmacists to administer that vaccine. Someone got the idea that that's the solution. And like dominoes, okay, states changed the regulation so that pharmacists could provide that important service. And today, most people don't even realize that, a few 7 or 8 years ago that pharmacists couldn't do that, because today almost 25% of all vaccinations for not just the flu vaccine, but, shingles and, and other, I'll say, common ailments, are performed by pharmacists in pharmacies all across the country. And we talk about the fact that let's not wait for another, health scare, okay, to change those regulations. Let's do it now.
Great. Well, Larry, unfortunately, we have to wrap this up. Your comments have been fantastic. Please join me in a round of applause for Larry for sharing his time and his thoughts with us.